I suspect I don't need to remind most of you about the public health consequences of climate change, in fact, labeled as one of the greatest threats to global health of the 21st century. There are many direct consequences of climate change of concern. Heat and heat waves. Even as I speak, much of the United States is experiencing excess heat at the moment, and this has been the experience in Europe and elsewhere across the summer. Going along with heat and climate change, we have drought, a problem in many parts of the world at the moment, and coming with drought and heat, wildfires. Wildfire smoke, in fact, has covered much of the United States, Europe, and Australia, as we have experienced larger and more frequent wildfires than ever as climate change has taken hold. Of course, air pollution will worsen with climate change, ozone in particular, and we're concerned about changing patterns of vectors that drive infectious diseases. There are important and sweeping indirect consequences. Shortage of water may affect food supplies and lead to famine. People may move. We may have climate migrants and refugees in places that have lost their food supply and their water supplies. There may be social disruption as a consequence, and certainly our population well-being is threatened by worry about the consequences of climate change. We will struggle to adapt and to mitigate, but that is also those are also domains of public health. So we have much work to do together, and our task force report is intended to galvanize us into action as the public health community of ASPPH. Thank you.
Unless immediate action is taken, climate change will continue to damage our planet and human health. We now have a brief period of time when we can still act to stem the worst impacts. Our schools and programs of public health have a unique role to play in addressing climate change. We must first train the next generation of leaders, whether enrolled in our schools or already in the workforce. They need to be prepared to find solutions to climate change and the health problems that go along with it. Second, we must build research capacity on climate change and health to inform policies. And third, we must work to develop policies that put the research findings into practice in our communities, nationally and globally, to prevent the public health impacts of climate change. Finally, as schools of public health and programs of public health, we have a responsibility to speak up, to share what we have learned, and to advocate for evidence-based solutions to climate change. We will not be successful unless we make sure underserved minority populations who are hit hardest by climate change are protected. We must form strong partnerships with government, community groups, and others in a wide range of disciplines to bring about environmental justice. Now is the time for the schools and programs of public health to act. Together, we can make a difference today and for future generations.
Climate change is one of the greatest challenges of our time, and yet there is optimism that acting now will get us into the future we all envision. We cannot allow ourselves to become overwhelmed and complacent. We must draw hope from the significant innovations and effective solutions currently already being implemented, with more only waiting necessary technological advancements or funding. Well-designed solutions have been shown to demonstrate a triple win in that they simultaneously address climate change, provide health benefits, and bolster the economy. ASPPH and our member schools and programs of public health are committed to addressing the climate change and health crisis. There is much we can do together as a public health community and in partnership with all of you, all the disciplines and sectors, to improve health and well-being for everyone, everywhere, now and into the future.